السلام عليكم، وياكم دكتور محمد حسين. مستمرين بمحاضرات Anatomy of the Lower Limb. موضوعنا لهذا الأسبوع راح نتكلم به عن thigh. الفيديو الأول راح نتكلم به عن bones of the thigh. بالبداية في introduction سريع. The thigh is the region of the lower limb between the hip and the knee joint. أخذته بالبداية بالintroduction وعرفنا إنه regions of the lower limb قسمها into thigh, leg and foot. الثاي هي the region of the lower limb that extend from the hip joint to the knee joint. مثل ما تشوفون anterior thigh is larger than the posterior thigh. ليش؟ because of the presence of the gluteal region. الثاي posteriorly يمتد from this fold of the skin which is called the gluteal fold اللي يمثل لنا lower boundary of the gluteal region to the knee، بينما anteriorly from the hip to the knee. لذلك anterior thigh is greater or larger than the posterior thigh. The thigh is separated from the abdominal wall by the inguinal ligament. تعرفون inguinal ligament is the layer of connective tissue that extends from the pubic tubercle to anterior superior iliac spine. Posteriorly separated from the gluteal region by the gluteal fold اللي حكينا عنه fold of skin. هذا on a superficially and on a deeper plane separated by the inferior margin of this muscle called gluteus maximus muscle and the other small muscle which is the quadratus femoris muscle. هتكلم عن structures that enter and leave the top of the thigh by three routes. Structure enter and leave the lower part of the or the bottom of the thigh by one route. The three routes through which the structures enter and leave the thigh are: anteriorly, the thigh communicates with the abdominal cavity through the aperture or the gap that lies between the inguinal ligament and the pelvic bone. وهذه حكينا عنه بالمحاضرة original anatomy وعرفنا major structures that passing through this aperture or this gap وقسمناها into three muscles, three nerves and three vessels. The three muscles are iliopsoas, iliacus and psoas major and pectineus muscle, and the three nerves that تذكرون قلنا كلها تبدأ femoral أو contain femoral, which are the femoral nerve, femoral branch of genitofemoral and lateral femoral cutaneous nerve or lateral cutaneous nerve of the thigh. With three vessels are femoral artery, femoral vein and femoral lymphatic vessels. Still anteriorly and medially and the obturator canal through which pass the obturator vessels and obturator nerve from the pelvic cavity to the medial compartment of the thigh. Posteriorly, the thigh is continuous with the gluteal region, and the major structure passed here is the sciatic nerve, which is the major and the largest nerve in the body, in addition to other structures such as the posterior cutaneous nerve of the thigh. Inferiorly, the thigh is continuous with the leg through this popliteal fossa. راح المحاضرة الجاية إن شاء الله نتكلم عنها in details. Structure that passes through here اللي هي the two branches of the sciatic nerve, which is the tibial and common fibular nerves posteriorly, and popliteal artery and popliteal vein, which are the communications or continuation of the femoral vessels. Okay. طبعا من الثاي تفوت the adductor canal، بعدين adductor hiatus تدخل into the popliteal fossa and then to the leg. Now bones. The major البونز اللي راح نتكلم عنها هي femur, the patella, the leg bones which are the tibia and the fibula. The skeletal support for the thigh is the femur. Femur هو مثل لنا skeletal support، skeletal support for the legs the tibia and fibula. الفيمر تكلمنا عنه بالمحاضرة السابقة، أخذنا البروكسيمال بارت and شوية من الشافت. الآن راح نكمل الشافت and the distal part of the femur. الباتيلا حناخذها in details. وبالنسبة للleg bones which are the tibia and the fibula حنتكلم عن البروكسيمال part and the shaft، لأنه البقية distal end of the tibia and fibula نتكلم عليها إن شاء الله in the leg and ankle joint. The shaft of the femur. The shaft of the femur is bowed forward يعني مقوس وللأمام. هذه anterior هاي posterior، بنشوفها من lateral side راح نشوفها مقوس للأمام. The shaft of the femur has an oblique course from the neck of the femur to the distal end. وهاي تكلمنا عنها وإذا تذكرون بالمحاضرات السابقة بالoriginal anatomy قلنا إنه الأنجل between the long axis of the shaft of the femur and the long axis of the thigh is 7 degree 7 درجة، وهذا يخلي لنا distal end of the femur near the midline، يعني near the line of gravity، وهذا this is very important to maintain balance during standing position. Now the shaft of the femur is triangular in cross section. هذا cross section in the middle of the shaft. It has a medial border, lateral border and posterior border, وسمينا posterior border linea aspera. And it has three surfaces, which are the anterior, the lateral or posterolateral, and the medial or posterior-medial surface. Linea aspera diverge, that they can diverge proximally into two lines and distally into two lines. هذه linea aspera proximally diverge into two lines. The medial part called the pectineal line or spiral line, and the lateral one is continuous to the gluteal tuberosity. Inferiorly, it's also diverged into two lines. The medial one is the medial supracondyle line, and the lateral one is the lateral supracondylar line. The medial supracondylar line ends in an elevation of bone called adductor tubercle, which is the site for insertion of the adductor magnus muscle. The surfaces between these two lines called popliteal surface يمثلن الفلور of the popliteal fossa. The distal end of the femur. The distal end of the femur, it has represented by two large prominent bony prominence called condyles, medial and lateral condyles, which are for articulation with the similar condyles of the tibia, forming the knee joint. Posteriorly, the two condyles separated by a fossa called intercondylar fossa, and anteriorly the two condyles are in contact with each other, forming a surface called patellar surface for articulation with the patella. راح نتكلم عليها إن شاء الله. Regarding the intercondylar fossa, which is on the posterior part of the bone, has two important sites or facets for attachment of two important ligaments of the knee joint, which are called the cruciate ligaments. The medial condyle is for the attachment of the posterior cruciate ligament, and the lateral is for attachment of anterior cruciate ligament. The medial for the posterior, والlateral for the anterior. تحفظها P posterior on the medial condyle. In addition to that, above these condyles there are another large bony prominence called epicondyle. Epicondyle اسمه epi فوق وcondyle and فوق الcondyle. Lateral epicondyle is larger than the medial epicondyle and has two important facets for the attachment of two muscles. One is the lateral head of gastrocnemius muscle, which is the muscle of the calf, posterior calf, one of the important large muscle of the leg, and the other is the lower part is for the tendon of popliteus muscle. Popliteus muscle is the muscle of the popliteal fossa, and it's an important muscle that play an important role during the locking and the movement of the knee joint. راح نتكلم عليها وين knee joint إن شاء الله. Patella actually is a large or called knee cup. والباتيلا معناها Greek word معناها dish، يعني تشبه الدش. Actually is a sesamoid bone, large sesamoid bone. That the cruciate sesamoid bone here bones formed within a joint. لما within the tendon، when tendon cross a joint لازم مرات يصير اكو فد بون sesamoid bone. هذا يساعد على انه ما يصير wearing او ما يصير اعوجاج بالتندن لما يصير movement in the joint. The patella شكلها triangular in shape. It has an base superiorly and apex inferiorly. The base through which attach an important tendon of the muscles of the anterior thigh called quadriceps femoris tendon, and the apex through which attach a ligament called patellar ligament. Here from the patellar ligament connect the apex of the patella to the tuberosity of the tibia called tibial tuberosity. Actually بعض الكتب يقولون إنه الباتيلر ligament هو continuation of the quadriceps femoris tendon، وبعدين حنتكلم عليها إن شاء الله. هذه anterior. The posterior surface has two large facets, one called lateral for the articulation with the lateral femoral condyle, and the medial for articulation with the medial femoral condyle. The lateral one is larger than the medial لأنه lateral femoral condyle larger than the medial femoral condyle. Now هنتكلم عن bones of the leg. نبدي بالتيبيا. Tibia is the medial and the larger of the two bones in the leg, and the only one that articulate with the femur at the knee joint. فقط التيبيا هي تسوي articulation with the femur at the knee joint. The fibula has no role in articulation and no role in weight bearing. The tibia is the medial and the larger bone, and the fibula is the lateral bone. هنتكلم عن proximal part of the tibia ونتكلم شوية عن الشافت، بينما distal part نخليه للويا leg. Proximal part of the tibia has two bony prominences أو circular discs called condyles، تشبه الcondyles أو مالت الفيمر and is for articulation with the femur on the knee joint. One is called medial condyle on the medial side and the lateral condyle on the lateral side. This is a superior view of one of the tibial condyles of one of the tibia. superior view نشوفها يعني من الأعلى. راح نشوف هذه two condyles. This is the medial condyle and this is the lateral condyle. The medial and lateral condyles are articular وذلك نشوفها covered by hyaline cartilage. بينما area in between them is non-articular and it's called the intercondylar region in between. But it is very important for attachment of ligaments راح نتكلم عليها إن شاء الله. Together medial and lateral condyle with the intercondylar region هنسميها tibial plateau. يعني السيرفس اللي نشوفه من الأعلى كله يسمى tibial plateau. Tibial condyles, الميديال condyle is larger than the lateral condyle والميديال condyle شكلها oval in shape بينما اللاترال condyle نشوفها circular in shape. الانز مالتها هنا تكون قريبة مع بعضها، هنا الانز تكون بعيدة شوية أبعد. كل condyle has بالسنتر مالته concave center for articulation with the femoral condyle، والاوتر سايد تكون flat for articulation of the meniscus. meniscus هو الغضروف الهلالي، هو غضروف يكون داخل الني جوينت راح نتكلم عليه بعدين، وظيفته هو شوك اوبزرفر. اذا كل كوندايل سنترال بارت يكون كونكيف مقعر للداخل for the articulation with the femoral condyle، والاوتر سايد يكون flat for articulation or for attachment of the medial meniscus. هتكلم عن الانتركوندايلر ريجن، وقلنا الانتركوندايلر ريجن don't take part in articulation، ما بيها articulation but is an important area for attachment of ligaments and cartilages. The intercondylar region has 6 distinct facets for attachment of menisci and cruciate ligaments. The anterior عنده 3 والposterior part عنده 4. هذه صورة بين الني جوينت حتى تعرفون شنو يعني meniscus وشنو يعني cruciate. طبعا هنتكلم عن ديتيلز من ناخذ الني جوينت. هذا الني جوينت فاتحين الكبسول مالته حتى نشوف الداخل، والني هنا صايره فليكشن 90 درجة. هذه منه anterior view. This blue parts تسميها meniscus. meniscus هو الغضروف الهلالي اللي موجود هو فايبروكارتلج بين الني العفو بين الفيمر اند التيبيا، وظيفته هي شوك اوبزرفر. الكروشيت ligaments هذه ligaments connect the tibia with the femur وسميت كروشيت او هلاليه العفو صليبيه لانه واحد كروس الثاني على شكل صليب. تمام. Anteriorly it has 3 facets. One for the attachment of anterior attachment of medial meniscus, one for the anterior cruciate ligament, and one for the anterior attachment of lateral meniscus. إذن كل meniscus عنده 2 attachment، واحدة anterior واحدة posterior. يعني الميديال meniscus عنده anterior attachment و posterior attachment، والlateral meniscus عنده anterior attachment و posterior attachment. فصار 4. وعندنا anterior cruciate ligament وعندنا posterior cruciate ligament، صار 6. 3 بالanterior part و3 بالposterior part. posteriorly عندنا هنا posterior attachment of the lateral meniscus, posterior attachment of the medial meniscus, and attachment of the posterior cruciate ligaments. حتى نقدر نحفظها ونتذكرها بسهولة. نتذكر انه قلنا ان الميديال meniscus هي اكبر وسي شيب والانز مالتها متباعدة وتكون اوفال، بينما lateral meniscus اصغر الانز مالتها متقاربة. فالاتاتشمنت اوف ذا ميديال meniscus راح تكون واحدة بعيدة عن الثانية، واحدة قريبة من هالطرف واحدة قريبة من هالطرف، بينما الاتاتشمنت اوف lateral meniscus تكون قريبة، واحدة قريبة على الثانية، يعني قريبة من السنتر مال intercondylar area. Now نجي للاتاتشمنت اوف cruciate ligaments. دائما الكروشيت ligaments سواء anterior او posterior يصير الاتاتشمنت مالته posterior to the medial meniscus. يعني الانتيريور cruciate ligament راح يصير posterior لل anterior attachment of the medial meniscus. الposterior cruciate ligaments راح يصير posterior to the posterior attachment of the cruciate ligament. الcruciate ligament سواء كان anterior or posterior يكون الاتاتش مالته posterior to the attachment of the cruciate ligament. Tibial tuberosity. Tibial tuberosity هو عبارة عن inverted triangular area on the anterior aspect of the tibia below the junction between the two condyles. It is a site for attachment of patella ligament, which is a continuation of quadriceps femoris tendon below the patella. هذه هو tibial tuberosity. This is an anterior view of the tibia. These are two condyles. الاتاتشمنت النص بالنص بيناتهم يبدي triangular area elevation of bone. طبعا palpable تقدر تحسه. هذا اسمه tibial tuberosity. Tibial tuberosity for attachment of the patellar ligament. Now, shaft of the tibia is also triangular. It has got anterior, medial, and border and lateral border. نسمي lateral border interosseous border. ليش interosseous؟ لأنه بين العظام صاير البوردر بين التibia and fibula. And it has got three surfaces which are medial, lateral, and posterior surface. هنتكلم عنها يعني شوية عن كل surface أو full border. This is the anterior border, the medial border, and the lateral border. The anterior border تبدي من apex of the tibial tuberosity وتستمر inferiorly. The anterior border together with the medial surface نسميها subcutaneous palpable تقدر تحسهم بإيدك. بقية البوردر والsurface are not palpable ما تقدر تحسهم. The interosseous border started from the lateral femoral lateral tibial condyle وتستمر on the lateral surface between يعني for the attachment of the membrane called interosseous membrane راح اتكلم عنها بالleg. The medial border is deep صايرة deep وما تنحس started from the medial condyle and تستمر anteriorly. Now it has got three surfaces between the anterior and the medial border. Medial surface here is the lateral surface between the anterior and interosseous border and a posterior surface between the medial and interosseous borders. هتكلم عن الميديال سيرفيس. قلنا الميديال سيرفيس lies between the medial border and the anterior border والميديال سيرفيس is subcutaneous palpable نقدر نحسه ويسمى shin of the tibia. هو وهذه الانتيريور border نسميها shin of the tibia. It has an important roughing area for attachment of the muscle. هذه المسلز three muscles sartorius, gracilis and semitendinosus مجموعهم نسميهم bis incernus. bis incernus يعني تشبه الجوز فوت يعني مثل القدم البجعة أو يعني البجعة أو البطة. Sartorius is a muscle of anterior compartment. Gracilis is a muscle of the medial compartment, and semitendinosus is a muscle of the posterior compartment. The posterior surface lies between the interosseous and the medial border. It has an important line called soleal line for attachment of the muscle. This line pass from here the area for articulation with the proximal head of the femur وpass obliquely يعني يبدي من lateral to the medial for attachment of the interosseous for attachment of the deep muscles of the leg. Now the fibula is the lateral bone of the leg. Does not take part in the formation of the knee joint or in weight bearing. ما تدخل لا بالويت bearing ولا بالكني joint. فقط هي مثل الفريم. والفيبولا معناها باليوناني معناها بن مثل الدبوس الورقي. It has got head, neck and shaft. حنتكلم عن head of the fibula. The head of the fibula أول شيء راح تشوفه قدامك هو this facet for articulation with the similar facet on the lateral condyle of the tibia. Above this راح يبدي هذا blunt area الhead نسميه apex or styloid process. Below the styloid process راح نلاقي هنا attachment for the fibular collateral ligament of the knee or the lateral collateral ligament, and below this is an important site for attachment of an important muscle of the posterior group of the thigh, which is the biceps femoris muscle. Regarding the neck مثل a small area of transition between the head and the shaft. Importantly here we can find the common fibular nerve passing from posterior through the posterolaterally to anterior. وهذا المكان site is an important site for the injury of the common fibular nerve. إذا صار fracture هنا بالفibula ممكن يصير injury to the common fibular nerve. The shaft has got three borders, which is the anterior border, the interosseous border or the medial border and posterior border, and both three surfaces, the lateral surface, the medial surface and the posterior surface. The posterior surface اللي بيفيد crest نسميه the medial crest of the foot. The three surfaces, which is the lateral and the medial and the posterior surface, is associated with the three compartments of the leg. The leg عندنا be three compartments: lateral, medial and posterior compartment of the leg. Thank you for your attention, and I hope to meet you in a next presentation.